This video will highlight some key data entry features on a TARN submission. Each TARN submission has a unique submission ID number, which should be used when discussing patients with TARN. Patient name should never be used in any correspondence with TARN and should only be recorded in the specific name field on each submission. This field is encrypted before TARN receives the submission. This is because as a non-NHS organisation, we are not legally allowed to see this information. The same applies to full patient postcodes and hospital numbers. We provide two different datasets for data entry. By default, the submission opens in the core dataset, which should be used by most hospitals for most patients. You can access the extended dataset by clicking Access Extended Dataset. This can be used for complex patients who are admitted directly to the ward or have multiple critical care stays, for example. Once a submission is updated to the extended dataset, it cannot be reverted back to core. Each submission contains a large number of data fields. Those marked with a red asterisk are mandatory and must be completed before the submission is dispatched to TARN. Please complete all fields where data is available to you. Completion of only mandatory fields will negatively affect your hospital's data quality. There is help text available throughout the submission. This can be accessed by clicking a field name and is designed to provide further information about the data required. If we click NHS patient number, for example, we're given information about what to do if NHS number is missing. If you are unsure how to respond to any of the data fields on the system, please view the help text as a first step. If you then require further help, please contact our support team. The data entered on the duplicate checking screen has been pulled through to the submission, and the patient's age has been calculated using the date of birth and date of incident. If we scroll to the bottom of the page, we see a section called Other Audits. If your patient has sustained one of the injuries listed here, your submission will include some additional questions relevant to this injury. It is important that you save your data frequently by clicking on the Save Changes button. The system will log you out of your account after 10 minutes of inactivity, and any unsaved data will be lost. If you have completed the full page, you can click Save and Next to save your data and be taken to the next section of the submission. Any field that is marked by the plus button icon allows you to record more than one answer. Here, for example, we can record that the patient had evidence of alcohol on board and evidence of drug intoxication. If we click Save and Next, we come to the pre-hospital section. Here we can see an auto-populate button. This can be used to populate a date field automatically using the first date supplied. However, please use this with caution. If the patient is treated around midnight, the first date in a section may be different to any subsequent dates. The pre-hospital section allows you to record observations and interventions performed at scene before arrival at the first hospital. Please record the first observations performed. When data is entered and saved, it is moved to the crumb trail in the submission menu. This allows additional data for the same field to be recorded. You may, for example, need to record multiple attendants. Only record interventions made in this location, so the pre-hospital section should only contain interventions performed pre-hospital. We click Save and Next, we come to the emergency department section. Here we record the first observations made on arrival in ED. If the patient arrives intubated, no Glasgow Coma scale should be recorded, as GCS is a measure of consciousness and the patient will have been made artificially unconscious in order to intubate. The same applies to unassisted respiratory rate. If we click Save and Next, we come to the ED Attendants page. There is a long list of attendant types, but we require only doctors and nurse consultants to be recorded, as these are the attendants we routinely report on. You should record the first and most senior attendant from each specialty. In this example, we have a trauma team arriving to see the patient at 10 o'clock. The team consists of a consultant in emergency medicine, an ST6 in the same specialty, a consultant in orthopaedics, and an ST7 in maxillofacial surgery. From this group, we must record the consultant in emergency medicine, the consultant in orthopaedics, and the ST7 in maxillofacial surgery, as they are the first and most senior from each of the different specialties. If we have a later group of attendees at 10:30, who consist of a consultant in maxillofacial surgery and an ST7 in emergency medicine, we must record the consultant in maxillofacial surgery, as they are more senior than the attendant from the same specialty who saw the patient earlier. We don't need to record the ST7 in emergency medicine, as we already have a more senior attendant from that specialty seeing the patient. When the first attendant has been saved, this is listed in the crom trail in the menu, and the main screen is blank so that you can record any additional attendants. Check the help text for help with doctor grades. If we click Save and Next, we come to the imaging section. You should record the first of each type of imaging, and then any subsequent imaging that confirms or rules out an injury. In practice, you're likely to need to record all CT and MRI scans, but you may not need to record all X-rays if these scans do not comment on injuries. You should copy and paste the imaging reports into the report box, shown here, ensuring the patient's name has been removed first. Once you have saved imaging data, this is stored in the crom trail in the menu to allow you to record additional imaging. If we click Save and Next, we come to the operations section. Operative procedures are listed by body area. You can then select the appropriate procedure and click the down arrow to select this procedure. You can record multiple procedures together if they are performed during the same theatre visit. Please provide a description of the procedure. You can copy and paste the operation notes here, but please remove the patient's name first. Once you have completed the first theatre stay and saved the data, this will be stored in the crom trail in the menu to allow you to enter additional theatre visits. If we click Save and Next, we come to the critical care section. If your patient is admitted to critical care, please record the first set of observations and interventions. Record the critical care attendants using the same criteria as ED attendants, and only record attendants who see the patient on their first day in critical care. If we click Save and Next, we come to the ward section. You can record multiple different ward stays by saving the first ward and then clicking on Add New Section. If we click Save and Next, we come to the At Discharge section. Here you should record all clinically confirmed injuries with the source of confirmation, discharge summary, operation notes, etc. Please record all documented pre-existing medical conditions using the drop-down menu. If the patient is readmitted within 30 days for further treatment of the traumatic injuries, this should be recorded here. Once the submission is complete, click Validate and Dispatch. The system will perform a check to ensure you've completed all mandatory questions and that your dates and times are in chronological order. Any issues that require action are highlighted to you in red. If you click on the section name, you'll be taken to the page requiring amendment. Now that all required corrections have been made, you can click Dispatch to TARN. Once this is done, the submission can no longer be amended by you and will be processed by the TARN coding team. If we need to return or reject a submission, we will leave a comment in the diary section. You can view this by clicking View Diary. If you require any help with data entry, please contact our support team.